Welcome back to the American College of Surgeons Bulletin Brief from the Frontline Surgeons Voices. And with me today is a return guest and good friend, Christian Chaljan. And Christian, of course, runs our efforts for the American College of Surgeons Division of Healthcare Advocacy and Policy in Washington, D.C. Welcome back, Christian.
Thanks very much, Dr. Wexner. Happy to be here.
Delighted to have you here, and I know you've got your sleeves rolled up working, as you always are, on our behalf so that we can continue to provide access and care for our patients. One of our last conversations for Bulletin Brief, we were talking about the 2020 cuts, and everybody breathed a sigh of relief when it didn't happen, and here we are again, now in the fall of 2021, looking at another round. Last year, the Surgical Coalition was formed through the efforts of you and Franco Pelka, Patrick Bailey, the entire ACS, which was very helpful. So perhaps we can start, where are we now? That might be the next logical question.
Sure, no, I appreciate that. We, the College of Surgeons, led an effort last year to stop the significant Medicare payment cuts that were scheduled for 2021. This was a huge effort last year in a very difficult environment to get Congress to stop these cuts, but we were successful. The challenge there, though, is we were successful for a one-year patch, so they stopped the cuts for 1 year. Now we're facing cuts again come January 1, 2022. Here in just a little over 4 months, we're going to see a close to a 9% cut happen for the entire physician community. This one's a little bit interesting in that this is not just surgery. This applies to the entire physician community. And so we're working hand in hand with the entire physician, all the physician organizations, and working to get these payment cuts stopped by Congress. So big effort this year, and that's a major focus of the college right now.
Are we still working in the context of the Surgical Coalition?
Absolutely, absolutely. And that's working really in two ways. One, when I took over as director in 2008, I created the Surgical Coalition, all the 25 or so surgical groups working in Washington on behalf of surgeons and surgical patients. And the Surgical Coalition is incredibly active on this. That includes neurosurgeons and orthopedic surgeons and the whole gamut of surgery and the whole house of surgery. Last year, we created what we call the Surgical Care Coalition in addition to the Surgical Coalition. And that is a group of about a dozen or so surgical groups that are working to elevate the effort even more. How can we take the effort of this advocacy effort to stop these cuts and the like, and take it to that PR, media, social media atmosphere where we need to gather support that way? And so we invested some resources into that. Those efforts continue. But I'm a fan of the idea, as you know, of building coalitions and working in coalitions. In coalitions, we are stronger and more effective. We also have coalition with the American Medical Association, with the family physicians, with the internists. We're working in coalitions with them on this issue. So this is sort of a coalition of coalitions, if you will, coming together to stop these cuts. And that's really the key to what it is that we need to be doing.
Good. And for those of our viewers and listeners who are engaged in Twitter, it's at Surgeons Care. So for Twitter, that's something that we're very active at disseminating. And you mentioned the message is put out that way. So encourage people to participate in getting that message out. And speaking of the message, what we'd like to know is, what is your message for us? You've presented us with a challenge, another almost 10% across the board cut with threats of therefore decreased access to patients, to the public. How can we help?
So in a number of ways that we can help. We're going to be sending out to all fellows an email asking them to get onto surgeonsvoice.org and email their member of Congress and let them know the importance of this issue and the need for action this year on this. The more support that we can get, the more members of Congress that we can get showing that public support for stopping these Medicare payment cuts is going to be essential. This is likely going to get done in December. And I am more concerned than I've ever been in the past that these cuts could actually go into effect. I know we've been down this road a number of times, and I talk to surgeons around the country who will say to me, Christian, we've been down this road before. You always do a great job and you always get these cuts stopped. I'm not really worried about it. I'm telling you, we need to be worried about it. These cuts affect across the board. And as many people know, it's not just Medicare payment cuts, because private payers oftentimes pay based off of Medicare. And so the private payers, they don't want to do the work of creating their own fee schedule. So they just say, we'll pay 5% more, 10% more, 5% less than Medicare. Well, if Medicare makes those payment cuts happen, there's a ripple effect that goes across the board. I am very concerned about the private practice surgeons who are running small businesses in essence, and these payment cuts will have a dramatic impact on private practice. But I would also argue very strongly that these cuts don't just affect those in private practice. Employed surgeons who are negotiating contracts with their hospitals, if all of a sudden that hospital is getting less revenue coming in from Medicare for the procedures that those surgeons are performing, those hospitals are going to pay less in the next year, and the contract is going to be less the next time where it comes up. So this affects everybody across the board, and engaging in the process early on, starting that, writing those emails is essential to the work that we're going to need to do to get this done by the end of the year.
And you and your staff make it very easy for us to send those letters, because all we do is log in and we know, or the algorithm knows who are our reps, who are our senators, and you just automatically send them. And just to put it in context, I suppose, do you know how many letters were sent last year by fellows?
We had thousands of surgeons engaged in this effort last year, and we saw thousands of letters come in on this, and we're going to need that same effort again this year. You're absolutely right. We know surgeons are incredibly busy, and we know that the surgeons are not, available at all hours in terms of, if it's 2 a.m., you can click on the email, you can click the link, and it's about 3 clicks, I think, that get you through the system and has those emails go out. I worked in congressional offices before I worked at the American College of Surgeons. I counted emails and letters, and I know what it takes as far as to get attention in a congressional office. They care what their constituents are asking for. Congress right now is in such a tight margin of Democrats and Republicans that the elections matter a lot, and their constituents' voices matter a lot. If they're hearing about a particular issue, they're going to know about it in that office. So we need to make sure that they know about this one and get those emails into those members of Congresses. Last
year, one of the arguments that we raised was, well, this is COVID, and people have had to shut down their practices, haven't been able to do surgery, and the like, and that may or may not have, and you can tell me, may or may not have gained some traction, that concept. And now we're still in COVID, but in a different way. There are many states in which people can't operate on patients who might need ICU beds. There are delayed diagnoses and sicker patients, making much of the surgery you do more complex. There's a whole host of other COVID-related issues. There's workforce shortages reported around the country, where other healthcare providers, not necessarily surgeons, just aren't available in numbers they used to be. Are we using these same reasons this year?
We are. We're doing this as sort of a multifold approach. One, yes, COVID is still around, and we're seeing a number of places where elective surgeries are being stopped still. But it's also the aspect of, for those who have come out of COVID a little bit more and practices are a little bit more stable, we don't want the economic impact of these cuts on these practices where there is employment issues, where if a surgeon is running a small practice and all of a sudden they see close to a 10% cut in their reimbursements, they're going to have to start making choices about whether or not to lay off staff, or how are they going to manage that size of a cut. So I worry about it from that perspective. I worry about it making sure that we still have the access to care available for patients. We saw what a delay in surgical care can mean in the past 18 months. We don't want to see more delays. We want to make sure the patients are getting that full access to care, and payment cuts are going to sort of have a massive impact on that. So we're using all of the approaches here. It's COVID, but it's all the rest of them as well. We clearly have a broken healthcare system at this point, and it's not working. We need to fix it in the long term, but Congress works very slowly. And so we have to work to fix the whole system. But right now, I need those payment cuts stopped on January 1st.
You mentioned earlier in our chat today that last year it was kind of surgeons in one corner and non-surgeons, or at least proceduralists in one corner and non-proceduralists in another. And it sounds like this year that's a somewhat different paradigm.
Yeah, I don't want to see us put this as, I don't think it's ever good when it's surgery pitted against primary care. We had some of that last year, and it wasn't helpful. We are stronger when we, as the House of Medicine, come together to push back on something on behalf of all our patients. And so I like that effort of sort of say, let's all work together and not pit surgery against primary care. Nothing beneficial there in the end. So stronger together.
So this year we're more able to do it because of the proposed cuts.
Proposed cuts go across the board. They part of those 9% cuts, 10% cuts are directly only on physicians. Part of it, in fact, it applies to the entire Medicare program. So we're partnering with hospitals and others within the Medicare program to make sure that we're all working towards that same goal.
Well, it's an important goal, and we certainly want you to succeed in reaching that goal. And we can help by sending in the letters and emails. So a question that I've been asked in the past, can somebody send letters more than once, or is that sort of like voting twice? Are you allowed to send letters multiple times?
No, we can definitely, you can definitely send letters more than once. And that's great. But what I would also suggest is not only once you send a letter, send it again if you want, but what you can also do is tell your colleagues, tell your friends, tell your family members, tell others to do it. We love it when you sort of go to that next level that sort of says, not only am I going to do it, I'm going to get 10 other people to do it. That's what we need. I've been in the hospitals before and talked to doctors surgeons sitting in doctors' lounges complaining about this or that. If you're sitting in those surgeons' lounges talking to the doctors, tell your colleagues, hey, get on and click and send an email. We need those emails to happen. So not only should you do it, but tell your colleagues to do it.
That's great. And as you mentioned, your friends, is it okay to tell patients? Is that something reasonable?
Absolutely. We need patient involvement just as much. Absolutely. 150%. Yes.
Well, great. It's it's unfortunate that when we're just recovering from a brief celebration of a reprieve, a stay last year, and here we are again gearing up to prevent one this year. And again, I certainly hope you are successful, but you've made it very evident that you can only be successful if we help you get there. So I urge everybody to get online, send in the letters and emails, tell friends, tell colleagues, tell patients, family, whoever, to do the same on our behalf. Any other messages with which you'd like to leave us before we part for the interview?
No, Dr. Wexler, I appreciate the opportunity to help get this message out. This is obviously critically important, and please go ahead and send those emails in, and we'll continue to keep everybody updated on our progress over the course of the next 4 months.
Well, we've got the web address for everybody to make it even easier.
Thanks, Dr. Wexler.
Thanks, Christian.